a short Q&A section where first of all, I'll be starting with some of the questions that were sent to us from emails and our social media, which Bahar will be answering for us. And at the same time, please feel free to post your questions in the chat box, and some of our staff, our lovely staff, as well as we will be trying to answer it however where possible, some of them via chat itself and some of them over the Zoom call. So yes, without further delay, I would like to welcome Bahari Joker. Welcome, Bahari. Thank you so much.
Thank you so much, Kabita. Thank you folks so much for joining us this morning, or whatever time it is if you're joining us from abroad. I'd like to take a moment to note that my colleague Ali Versi is joining me today as well, and he'll be posting some links in the chat as we go through and hopefully answering some of your questions directly. But there will be an opportunity to ask questions at the end of the presentation as well. So without further ado, I'm just gonna start my screen share here. Okay, so can everybody see the presentation? Are we okay? Perfect. So the Extended Health and Dental Plan. Right off the bat, just as a quick summary for you folks, the Calgary GSA Extended Health and Dental Plan is meant to cover and supplement all the supports that are not automatically covered through provincial healthcare. So if you are a resident of Alberta, you will have access to Alberta Health. If you're an international student arriving into Canada, you need to register for provincial healthcare. So if you are residing in the province of Alberta, you will register for Alberta Health. And traditionally speaking, provincial healthcare will cover you for doctor's visits, hospitalizations, examinations pertaining to different conditions, and is really meant to be your primary care support, whereby the Calgary GSA Extended Health and Dental Plan will cover you for the categories that are not covered by provincial healthcare and are very similar to what you would receive if you were an employee of a company. So what's covered? We have 4 key areas of coverage, including health coverage, dental coverage, vision coverage, and travel coverage. For health coverage specifically, we're looking at prescription drugs, vaccinations, health practitioner care. And when we talk about health practitioners, we're not talking about MDs and nurses. We're talking about massage, physio, chiro, as well as mental health supports, such as registered clinical counselors and psychologists. I just want to make sure here that we're okay. So with respect to the travel benefits that are provided through the Extended Health and Dental Plan, obviously this is a very particular year in that many folks are obviously not traveling due to the COVID-19 restrictions that are in place. However, the Calgary GSA travel plan was recently just extended to provide certain coverage levels for both COVID-19 and for folks who do find themselves needing to travel during these times. So if you are traveling, I highly, highly recommend that you visit our website and learn about the travel benefits, just so you know what is covered, as well as making sure that you're very well versed on the restrictions that are being put forward by the federal government. If you have any questions ever, feel free to give us a call, and I'll obviously be sharing our contact information at the end of the presentation. But it's just helpful to know that this benefit is obviously available to you. One quick caveat about the travel coverage: if you are an international student, the travel coverage does not support you while you are in your home country. However, if you are traveling to other countries as a student, not including Canada, obviously, you would have access to the travel benefits. So why do we have a group health and dental plan? So all of you will have the plan fee included on your tuition statement, and the plan itself was brought in by referendum a number of years ago as a standard fee that is collected, and these host of benefits are provided to you as members of the GSA. Just traditionally speaking, the Extended Health and Dental Plan can be very, very expensive if you were to go out and purchase the same suite of benefits as an individual. So there is a benefit to coming together as a collective and having this made available to all the students at the same time. Additionally, there tend to be quite a few discriminatory factors when you do go out and purchase it on an individual basis. So folks who tend to be a bit older, who might have pre-existing conditions, and typically women tend to pay more for an extended health and dental plan, and pre-existing conditions will either be available through a pretty hefty premium or will not be covered at all. So the Calgary GSA Extended Health and Dental Plan really is an equitable way for all students to have access to affordable extended health and dental services. So through the Calgary GSA Extended Health and Dental Plan, you have access to the student care networks. The networks are a tool that we make available to all of our partners across Canada that allows you to access discounted health practitioner services. So there's a long roster of practitioners that we work with across Canada. We're talking about over roughly 3,000 practitioners nationally that provide our students with discounts, and this includes physiotherapists, massage therapists, chiropractors. We have a national partnership with Rexall, as well as dental practitioners and vision practitioners. So to explain kind of how this works and how it relates to you as a student, I'll use the dental benefits as an example. So right off the bat, in the first column, we have the insured portion. The insured portion is what's automatically available to you as a member of the Calgary GSA when you're enrolled in the Extended Health and Dental Plan. And you can use the insured portion with any health practitioner and anywhere across Canada, and those benefits are available to you. However, if you do not have a dedicated dental practitioner that you've been going to for many, many years and you're open to visiting a new practitioner, if you visit our dental network and select one of our dental practitioners in the province of Alberta, you will receive 30% off of the totality of the services that you're receiving. So for preventative services, that brings you up to 100% coverage for the services that are being made available to you. Again, generally speaking, it's a really wonderful way to access discounts. And in Alberta specifically, I mean, obviously, if you're in different provinces, it varies a little bit. But in Alberta, dental benefits tend to be really, really expensive. And so it's helpful to just, yes.
Sorry to interrupt. There's a comment that your mic might be blocked. Your voice is kind of modulating.
Oh, is this better?
Yeah, it sounds good to me. Megan, I don't know if it's better for you. Yeah, all good. Go ahead.
Okay, perfect. Thank you for letting me know. So if there's, again, all the information about how to access the networks is available on the website, and I'm sure Ali will drop a link to the network section as well in the chat. One of the other benefits that are available to you through the Extended Health and Dental Plan is the Empower Me program. So the Empower Me program is the equivalent of an employee assistance plan, but is designed for students. And how it works essentially is that it's a program that's available to you 24/7, 365 days a year, whereby you'll call the dedicated number that's available to you or access it through the mobile app that's also available. And you can actually get access to mental health care practitioners and in an unlimited number of sessions, essentially, to support you for short-term mental health supports. So generally speaking, the Empower Me program can support you for any type of question that you might have or issue that you might have that you might be presenting. And again, just to reiterate, it is an unlimited model in that you can access it as many times as you need throughout the year. And unlike some of its counterparts, there is no cap as to how many sessions you can receive. The only caveat about the program is that it is a short-term solutions focused program. So if someone does need longer term care, the program will support you in transitioning you to a service that does provide longer term care, but it's a wonderful service in that you don't have to pay out of pocket to access it, unlike your traditional kind of mental health services whereby you would pay for the service and then get it reimbursed directly through the insurance company. And additionally, it's not to say that you do not have psychology coverage through the Extended Health and Dental Plan. Those benefits are obviously there and are there to support you, but this is just an alternative method to support students during these trying times. Under normal circumstances, most students would opt to have in-person sessions with the counselor that they're paired with. However, right now during COVID-19, students are being referred to virtual methods in which they will access practitioners through the service. So how the service works is that a student will contact the service, and this is just the general intake. So if you're in crisis, you can press 0 and you'll automatically be transferred to a crisis support counselor. And that process is slightly different from most students who will access it to receive like practitioner care. Otherwise, you can either press 8 and leave a message or wait on the line roughly about 35 seconds and be connected to an intake counselor who will take your information and the issue that you're presenting and will then proceed to find you a practitioner that best fits your needs. So the service is intended to try and pair students with practitioners that are, again, focused on the issue that they're presenting. So we will, where possible, try and pair you with a practitioner that potentially speaks your native tongue if English isn't your first language, or is maybe well-versed in, you know, an LGBTQ plus issue or a culturally sensitive issue, whatever it may be. We'll try our best to find a counselor that specializes in the issue that you're presenting. And just as a general kind of tidbit, if there is ever an instance where, you know, the chemistry between you and the practitioner that you're paired with isn't right, please come back to us. Please come back to the Empower Me program, and they will pair you off with another practitioner. You're not, obviously, it's not like a one-time done deal. We obviously want to make sure that all students are comfortable with the practitioner that they are paired with. So the program is also available internationally. So if you are residing outside of Canada, these are some of the dedicated phone numbers for 23 countries that we're automatically supporting students in. If you find yourself in a situation where you are not in one of these countries and do need additional support, there are ways in which that we can try and pair you with a practitioner, but you do need to come to us kind of directly, and we will make that connection. But this information is also available for you online. And I highly encourage folks who want to learn more about the Empower Me program to visit our website, because all this information is kind of posted in our FAQ, as well as on the Calgary GSA website as well. So a quick note about the Empower Me program. The final thing I'll say is that it is a confidential program in that your information is not shared back with the university. It is completely separate from the university programs, and the only time in which your information would be shared would be with your consent. So if for whatever reason you need to be referred back to the university and you want that to happen, that opportunity is available. However, again, confidentiality is key, and we adhere to obviously all of the provincial and national standards and guidelines. So that's just for your peace of mind. So a couple important deadlines for folks to note. So if this is your intake period, if you are a January start student, you have from January 4th to January 22nd to either opt out of the extended health and dental plan if you have alternative coverage. So if you have coverage through a partner, spouse, parent, or an employer, or you can use this opportunity to self-enroll if you're not automatically enrolled in the extended health and dental plan, which only kind of applies to a very small subset of students, and or enroll your dependents, which I know was one of the questions that had been previously posted to us. So all of these kind of different functions that you can complete are kind of posted on our website, and you will be receiving email communications from us that outline this information as well. But for folks who do have dependents and they want to enroll their dependents, a dependent is categorized as, again, a partner, a spouse, or a child under the age of 25. You have to complete it between January 4th and January 22nd. That's kind of the hard deadline to complete these transactions. And obviously there is a fee for enrolling dependents as well. So make sure you've paid your own tuition statement and the fees associated with the health and dental plan, and then you'll be able to enroll your dependents as well. For international students who are not residing in Canada and do not come back to Canada, essentially between now and July, we are hosting a retroactive opt-out period for international students in July, from July 5th to July 19th, whereby international students can opt out of the extended health and dental plan by demonstrating to us that they are an international student. So either, you know, uploading a copy of your study permit, an approval for a study permit, like your tuition statement that outlines that you're an international student, or really any documentation from the institution that clearly states that you're an international student. You can use that opportunity to remove yourself from the extended health and dental plan. Again, this is an exception that is specifically for the 2020-2021 academic year, and it applies to the September and January intakes, and we'll be reevaluating for both the spring and summer terms as we proceed to see how the COVID-19 situation unfolds, specifically in relation to international students coming back to Canada. So how to opt out for students who obviously are not international students and want to opt out during the change of coverage period from January 4th to January 22nd. You will need to provide us with proof of alternative coverage, and that can be a pay direct card with your name on it that says health and dental. It can be a letter from an employer. It can be a letter from the employer of a partner, a spouse, or a parent if you are still enrolled under a parent's plan. But ultimately, we just need any sort of identification that clearly states that you are just enrolled in insurance elsewhere. And insurance obviously does not include Alberta Health or primary care. So if you're an international student and you have private insurance for whatever reason to supplement for the care that you would receive from Alberta Health, that does not constitute as secondary coverage. It's really an extended health and dental plan. So again, as I mentioned earlier, all this information is available on our website, and you will be receiving email communications on opting out. So where to go if you have questions or if you need additional support. So this is a dedicated phone number for the Calgary GSA members through our care center that's located in Montreal, and it's available Monday to Friday, 9 a.m. to 5 p.m. Mountain time for you folks. And so obviously we understand that there are international students who are residing abroad and might not be able to call in during the dedicated times that are available. So there are a number of functionalities that are available through the website as well that allow you to ask your questions. So there's online chat, there's a web form where you can submit your questions. Someone will email you a response. So this is really wonderful for folks who have questions about their claims, who have questions about what's covered on the extended health and dental plan, or just generally have any other outstanding question with respect to the extended health and dental plan. And again, our website is a really wonderful resource in learning about what's covered through the extended health and dental plan and just learning about all of the different services that are available, including the networks, Empower Me, the updated travel information, and any other updates that might come up between now and the remainder of your term. So with that, I'm going to take some time to answer your questions.
Okay, Bahar, we've got a few questions in the chat box, which I think would be beneficial for everyone to hear. So the first question is from Megan, from Mega, sorry. She was asking if she is on a maternity leave during her studies, would she still be covered by the plan? And Mega, feel free to unmute yourself if you want to ask your question verbally, if you have any follow-ups.
Sure. Thanks, Ali. Yeah, so I mean, if I have already paid for my insurance for the whole year, and if I'm taking maternity leave in between, will I still be covered?
Yes, if you've paid for the extended health and dental plan, it will not impact your coverage. You should be fine. If you, for whatever reason, are getting a refund from the university and the health and dental plan fee is included in that refund and you need access to the health and dental plan, there are metrics in which we can support you with that, and it would have to, that request would need to go to the Calgary GSA, they would approve it, and then we would work with you in activating your coverage if for whatever reason you need to go on a leave of absence. But as long as you have paid for the benefits, you will continue to have access to the benefits, even if you're not taking courses. So.
Okay, thank you, yeah.
And I believe your second question was answered, but feel free to follow up if you have any.
Yeah, so like just like the dental network, do you have eye clinic network as well? There are like specific clinics where you collaborated and you get, students can get maximum coverage if we go to that specific eye clinic. Are there any like that?
Yes, so those network practitioners are listed on our website. I'm actually, you know what, if it's all right with you folks, I'll actually share my screen one more time and show you folks where to find this information. It's really easy, but I'll just go ahead and do this so that we can all be on the same page.
That would be great, thank you.
No problem at all. So can you folks see my screen here where it says Studentcare? Okay, perfect. So this is the home page. If you want to learn about the plan benefits and just explore what's available through the extended health and dental plan, you can put Calgary GSA and it'll come up and you select it. But for the network specifically, if you scroll down on the home page, it's just right here is the second part of what's available on the home page. So again, you can put the name of your institution. That's one way of accessing the networks. This is also an interactive map. So if you just want to scroll into your neighborhood, you can see what's kind of close by. And all of the practitioners will be listed there for you, or you can scroll here and just select the practitioner that you want. And then, sorry, this takes a couple of minutes, but it'll give you a list of practitioners that provide students with that extra discount.
Okay, there was eye as well, eye clinic as well. I didn't.
Yes, there are eye practitioners as well. So if you come here, you can just adjust that. So you can go to the Vision Network, and it'll give you the list of independent specialists that give our students an extra discount.
Nice.
Sorry, this will take a couple minutes to load, but it's essentially the same thing. It just gives you a list of vision practitioners that provide GSA members with discounts. And it's really wonderful for eye exams as well, because they tend to be quite pricey if you just go to kind of a standalone vision practitioner, whereby these are heavily discounted. So we're talking between $50 to $75 on average. So.
Okay. Thank you. Okay, again, I just have one more quick question. So, so if I have used some of the insurance from the dental, how do I know if I have, like, what I have left of?
Great question. So you can always call us. We can tell you how much is left based on the claims that you have on file. What's a really wonderful resource for students is the Pay Direct card. So a digital copy of the Pay Direct card is available online, and you use the Pay Direct card when you typically go to the dentist or the pharmacist for those services. And some health practitioners will also be able to do Pay Direct for you. And most dental clinics, when you do Pay Direct, can actually see how much you have left and will be able to do that calculation for you. But for whatever reason, if your dental clinic cannot tell you how much is left for the remainder of the year, you can always call us and we'll be able to verify that information for you as well. And if you set up an online account with Desjardins, which is the insurance company for the Calgary GSA Extended Health and Dental Plan, you should also be able to see your totals on their website as well. But if for whatever reason you do not set up a separate account, you can always call us and we'll be able to support you with that.
Okay, we can call you in that number you just gave earlier, right?
That's exactly right. Or you can submit a question via the secure platform on the website as well.
Okay, thank you so much, Bahare.
No, it's my pleasure.
So we have our next question from two different people asking a similar question about enrolling family members for just one part of the plan, so either dental or just vision, sort of to pick and choose. So that question is from Alireza and from Gideon Choi.
That is a great question. Let me just double check something for you folks before. So to enroll your dependents onto the Extended Health and Dental Plan, you have to enroll them into the full plan for the academic year that you are enrolled in. So all that information is available on our website, but when you go through the enrollment page, you'll be able to see what options are available to you. So that would be my best recommendation, is to go through that, and it gives you out the pricing. It lets you decide if you want to enroll one dependent or multiple dependents, and it'll give you all the details of plan coverage.
Okay, so we have one question from Joshua. They're asking what do you consider to be a partner? Like what are the conditions for you to enroll a partner into your plan?
Common law or married spouse is the typical definition. And if you have any questions or kind of specific nuances to your personal situation, you can always call us and our team will be able to kind of work through your personal criteria as well.
The next question is from Amanda. If we have opted out but lose employer coverage during this academic year, can we opt back in?
That is a great question. If you do lose your alternative coverage, if you have proof of having lost your alternative coverage, you can re-enroll, but you have to do it within 30 days of losing that alternative coverage. So just be mindful of the fact that it has to happen within that time period. But yes, there is an opportunity to re-enroll into the plan, and obviously there would be associated costs with re-enrolling into the plan.
Okay, I guess this question is for Kavita maybe, if this session will be uploaded anywhere.
Yes, I believe Megan has answered that in the chat box, but yes, we will be uploading it in our GSA website and perhaps also in our social media, but definitely in our website.
Okay, thank you. From Jayan is asking, if we are coming in midwinter 2021, then insurance will be counted on the day of our arrival or from January 2021?
If you are a January intake student, so if your fees are collected in January, your policy, your starts for the health and dental plan specifically starts January 1st until the following, like December 31st of the following year. However, for Alberta Health, that's a different conversation. So it's dependent on when you apply for Alberta Health.
Okay. From Harshil is asking, as this plan is different from the provincial plan, how would I opt for the provincial one? And when would the coverage of this plan be started once I arrive in Canada?
Yes, so the provincial plan, everybody needs to have access to primary care. So in case of emergencies, you want to be able to, access health services. So upon your arrival into Canada, please register for Alberta Health. If you're not residing in the province of Alberta for whatever reason, there are other provinces and each province has their own intake. But obviously in the province of Alberta, you apply for Alberta Health. Your extended health and dental plan, similar to the previous question, is in effect essentially from the intake period in which you have paid your fees. So if you are coming after the fact, your benefits will still be active and you'll be able to use them essentially upon arrival. But the period in which you can access your benefits is from, let's just take the January intake is January 1st to December 31st of the following year.
Okay. Next question is from Rahul. I deferred from fall 2020 to winter 2021. I will be completing my classes online and won't be in Calgary until August 2021. When will my plan start? Also, is it possible to start my plan from fall 2021?
Great question. I think it's, again, similar to the previous question in that your intake is from the period in which you pay your fees. So the University of Calgary has 4 intake periods: September, January, May, and I believe July, if I'm not mistaken. So again, depending on when you pay your fees, that is the intake period which you're in, and the start date and end date is all posted on our website. Unfortunately, we don't get to choose which intake you're in, and we can't change that on our end. It's completely up to when you pay your fees to the university.
Okay, the next question is from Nuokoro for the benefit of everyone. If you go to these practitioners, do you show them your insurance card to show them you're a GSA member? If yes, how do I get this card? And I believe I have posted the link on the website, on the chat box, but I'm going to post it again.
Perfect. Yeah, that's a great question. So when you go to a health practitioner, let's say a dentist or a pharmacist or even like a chiropractor, you can show them the Pay Direct card. For your benefit, there's also the Studentcare mobile app. It's a really wonderful resource in that it helps you submit your claims. However, there's also a digital copy of the Pay Direct card through the mobile app, or another option for folks who don't want to download the mobile app is just to take a screenshot by opening the PDF on your mobile device and just having that image with you. So what the practitioners will need is the insurance number as well as your student ID, which is your unique identifier. So with those 2 numbers, they'll be able to submit your claim directly to the insurance company. If for whatever reason, the practitioner in question can't submit your claim to the insurance company, and for folks who might start using the benefits like almost immediately, so if you start using them right now, there could be a potential lag in your benefits getting activated on the insurance end of things. So there's a blackout period for new incoming students that typically lasts about 4 weeks while we activate everybody in the system. So during that period, you can just hold on to your receipts. You still have access to those benefits. You'll just have to manually submit your receipts after the fact if they can't do direct bill. And if you ever have any questions about, whether you're covered and what's covered and how much is covered and how to access your benefits, you can always give us a call and we can kind of walk you through your individual case.
Okay, next question is from Kshitis. As now winter 21 term is online, so mostly we'll be coming to Canada in September 2021, but then only 4 months will remain in our plan. I guess the question is, Kshitis, and feel free to specify your question if I misunderstand, but you are covered for the whole year. And Yeah,
Yes.
I'm not sure what the question is. Go ahead. Bahar.
So if you are a January intake student and you are not coming back to Canada until after the July retroactive opt-out, you can actually opt out in July by proof of being an international student, recognizing that you're going to be coming in so close to essentially the end of your policy year. That's okay. That's not an issue. Obviously, you need to make that decision for yourself. So if you do come into Canada after you've opted out and do need access to the benefits, you will not be able to re-enroll into the benefits, and will have to wait until essentially your benefits reset the following January. So that's just something to be mindful of for anybody who is completing a retroactive opt-out.
Okay. So a question from 326906, will I get a personal insurance number?
Your personal insurance number is your student ID number, and then the policy number for the collective is the additional piece of information that you'll need to provide when you access the service for direct bill.
Okay, the next question is from Bushra, which I believe has been answered already. So I'm just going to skip to the next one. But Bushra, if you have a follow-up question, feel free to unmute yourself. And I'm going to move into Jayan's question. We have already paid our insurance before the new. We have already paid our insurance before the new insurance plan from the GSA has come, like COVID-19 policies. So the previously paid insurance will be included. The new policies in the previous one. If I understand the question correctly, maybe you're asking about coordination of benefits. Jane, feel free to unmute.
Yes, sir. I'm asking that if we have already paid our fees regarding GSA, then it will be counted towards the COVID-19 policy or any other policy which has arrived.
Jayan, to answer your question, if I'm understanding correctly, so for any adjustments that get made due to COVID-19, it will be applied to your policy, and you will be made aware of that. For the changes that were made, for example, to the travel plan to now support students for COVID-19, yes, those are in effect for you as well. Those are applied across the board to all members who are enrolled on the plan. I hope that answers your question.
Yes, sir. Thank you so much.
No problem.
Just to add to that, yes. So that's a very good question, Jane, and thanks for bringing it up. And since with COVID and all the restrictions, there are some of the health and dental plan that keeps getting updated, and as they get updated, we keep trying our best to update our website as well as sending it in our newsletters and social media. So please keep an eye on that, so that because we're doing our best to communicate all the updated information as Bahar provides us. So please keep an eye on our social medias and our websites, and you'll be seeing all the updated information there as the updates keep coming up.
Perfect. And I see the next question here, so I'll dive in if that's all right. So there's a question about a specific medication being covered under the Extended Health and Dental Plan. So if you have a medication that you want to verify whether it's covered under the GSA Extended Health and Dental Plan, I'd recommend actually calling our call center, and our team will be able to confirm that information for you. However, if for whatever reason your medication isn't automatically covered, there is a special process, a special authority process to have medications covered by the GSA plan that are not automatically covered, and it's called the drug exception process. That information is available on our website. So if for whatever reason you aren't able to get your medication automatically covered, you have to fill out a specific form, and you will need confirmation from your physician that it's a medication that cannot be supplemented by another medication. But there is a process in which you can access medications that might not be automatically covered, and it applies to very specific categories of medications, which I won't get into today. But if you have any difficulty accessing a specific medication, please do contact us, and our team can support you with that.
Okay, we've got a private question. Is it possible to pay the insurance premiums in installments if you're enrolling family members and the cost of that is too much?
Unfortunately, with family and dependent enrollments, it has to be all in one kind of payment. So our payment processing is unfortunately set up in a way that it has to be all in one go.
Okay, there's a question about PayDirect card, which is not only covered for, you can use it for not only prescription drugs, but also other services. So I will move on to the next question. It's about vaccination for COVID-19. If that becomes mandatory, will the plan cover that?
That's a great question. So as kind of just industry-wide and across Canada, we're currently operating under the assumption that the vaccine will be publicly available and will be funded through both the federal and provincial governments. But if for whatever reason there is a cost associated to it, we will work with the GSA in ensuring that a policy decision is made around that. And vaccines are currently covered by the Extended Health and Dental Plan. So if you get a flu shot and there's a cost associated to it, you can get it reimbursed through the Extended Health and Dental Plan. So yes, we will keep you folks updated as the vaccine situation unfolds nationally. There's a question about whether you can use the same PayDirect card from last year. Yes, you can absolutely. The policy information hasn't changed. It's the same information. The only time that would be different is if the insurance company for the plan changes. And so you're absolutely okay to use the plan. Sorry, Ali, I'll let you go ahead.
Yeah, no, I was going to get to the same question. So I'll move on to the next one. The student in the Studentcare app, they're asking for a student code and password. What are the initials?
So I believe you have to create your own login information for the mobile app to be able to access your account. So you set that up, and we can take that question offline if you're having difficulty with it. And all the information on how to set up and register for the app are available on the website as well.
And then from Margarita, the next question is, I do not have a student ID card. I do have a U of C staff card, which is current. Am I supposed to get a different card? Both my staff and student number is the same.
If your student ID is the same as your staff ID, then that's the number that will be applied for your policy to be able to
claim. There's, I believe those are all the questions. There's one more question from the opt-out regarding opt-out, but I can just post that link in the chat.
Sorry. Thank you so much, Ali. We have a few more questions that we received from our emails and social media, if you don't mind, Pahari.
For sure.
So I'd like to start with the general ones. One of the very frequent ones we get is related to province. So for example, if students continue their study from other provinces, then how do they access their health and dental benefits from other provinces? And if they require a health card from the province that they are residing in currently, or is it okay if they use the one from Alberta?
Oh, great question. So if for example, if you are a Vancouver resident and you are studying at the University of Calgary and you maintain your BC MSP, you can absolutely continue to use the Calgary GSA plan. That's no problem at all. So your plan is available nationally, and you can use those benefits essentially with any kind of licensed practitioner. Obviously, the only kind of, I wouldn't call it a restriction, but all of those limits are based on like the Alberta guide and what's available through the GSA plan. But that shouldn't be an issue. So you can use the plan in your home province, and you can use the plan in conjunction with any other provincial healthcare plan as well. So it doesn't have to be specifically Alberta Health. OHIP, BCMSP, Nova Scotia Health, and all that. That's totally fine.
Great, thank you so much. The next question is, I believe it's been answered, but is there a way to get a card for our health and dental insurance? It's the same as the mobile app, right?
Yeah, so the PayDirect card is all the same. I believe Ali has posted it in the chat. I'm going to do a quick screen share with you folks just so you can see what it looks like if you haven't opened it yet. If that's all right with folks, I'll do that right now. So this is what the PayDirect card looks like. I mean, obviously under normal circumstances, if you drop by campus, you could pick up a physical card. This is the front end and the back end. So you just put in your 8-digit student ID number, you need the carrier number and the group number. And really, again, you can just open this PDF on your phone and take a screenshot. You can write down these numbers and provide them to the health practitioner. They will be able to essentially process this information just with those 3 areas. But if for whatever reason you're having any difficulty accessing the PayDirect card, or having a difficulty with accessing direct pay with the practitioner, you can always claim your receipts after the fact as well. The mobile app is a really wonderful resource. If you're having any other difficulties and can't, access the mobile app, please give us a call and we can help you with your claims as well.
Great, thank you so much. So the next question is, I have recently opted out of my health and dental plan as well as I have full coverage within my workplace. Will I have to opt out of health and dental each semester annually, or do I have to do it only once?
Great question. You only need to do it once a year, so you don't have to do it January and then September, again, May, June, July. But you have to do it once per intake. Once you upload your proof of alternative coverage once, you don't need to do it again every other year. That information is in our system. So you just go in our systems and just verify that you want to opt out the second year and the third year and for however long it is that you're continuing your studies. It's just a practice that needs to happen on an annual basis.
Great, thank you so much. I think this is a very frequent one we get as well. So if we pay the health and dental in January and we defend in May, are we still covered until the end of the term, or when would the coverage end?
So you have 12 months of coverage. If you've paid for the benefits, the benefits will last for 12 months.
Thank you. Now we have one question from the for the COVID and international student side of things. So what are the options for international students who are studying from their home country for COVID-related issues?
Unfortunately, that would be reliant on essentially your basic coverage in your home country. So the equivalent to Alberta Health in your home country, that is not something that would apply to the health and dental plan, the extended health and dental plan, sorry.
I believe that's all we have because there are a few questions which has already been answered before, so I won't repeat that. So thank you so much from my end, Bahari.
Thank you.
And just to reiterate, so we have all of our information in the GSA website. There's a section specifically for student care, and if you go there, you can find all the information on how to claim, when to claim, what's your change of coverage period. But again, if any of it is confusing or overwhelming, which it can be because it's a lot of information, please feel free to send an email to any of us, either in my email or any email that you see on the website, and we'll do our best to answer you and direct you to the best possible solution for you. And besides that, like I already mentioned, that there's a lot of updated information coming up from Studentcare, which Bahari will be sending our way, and we will be doing our best to communicate it to you. So please, if you still have some questions, feel free to reach out to us through our social medias, and we will be doing our best to answer all the questions. I believe and Megan has kindly posted our website as well as the email where you can send any questions that you have, and Ali also had sent a lot of links for the Studentcare websites where you can claim, how to claim and everything. So thank you so much for that. And do we have any other questions that has not been answered from chat box, Ali?
I believe all the questions have been answered in one way or another. So if someone feels like they have a follow-up or their specific question has not been answered, please feel free to ask that now.
Great. Yes, thank you so much again, Bahari and Ali, for being here today and answering a lot of our questions, and to our staff, Megan as well as Rachel, for being here and answering some of the questions. And if you have any further questions, please feel free to send us an email or reach out to us in any way, and we'll be doing our best to answer your questions. So I feel like this should be the end. And again, thank you so much, Bahari and Ali. So I wish all of you a very happy new year, and may this year bring out the best and have the best to offer for all of you. And have a great day, everyone. Thank you.
Thank you so much. Have a lovely day, everyone.
Thanks. Bye.
Bye.